Dear friends and colleagues, thank you for inviting me to speak at this 28th Annual General Meeting and Scientific Conference of the Nigerian Society of Anaesthetists. I'm honoured to be addressing you as President-elect of the World Federation of Societies of Anaesthesiologists, and I send you greetings from my WFSA colleagues. I also send greetings to you all from my country, New Zealand. Tēnā koutou katoa. I'm now going to start my presentation. The anesthesiologist in contemporary times. This is a very appropriate theme for this meeting during a year where we have had a COVID-19 pandemic. I'm going to spend the next 15 minutes talking about a few sub-themes. Firstly, what is a medical expert? How does this relate to our specialty? What are our roles? What are the qualities that make us good anesthesiologists? And how can we use this knowledge of our roles and qualities to strengthen our specialty and provide better care for our patients? Just a little bit of information about the WFSA. The Nigerian Society of Anaesthetists is a valued member of the World Federation of Societies of Anaesthesiologists. We truly are a global federation. We have 135 member societies representing anesthesiologists in 150 countries worldwide. Our vision is universal access to safe anesthesia, and this fits very well with the World Health Organization's concept of universal health coverage, the idea that everybody in the world deserves access to good health care. I come from Christchurch in the South Island of New Zealand. New Zealand is to the southeast of Australia, right at the bottom of the South Pacific Ocean. When I travelled to Nigeria 3 years ago, it took me 40 hours to get from New Zealand to Abuja. The first question is, what is an anesthesiologist? This is Dr. Suzanne Nabalindo. I took this photo a few years ago when I was visiting Kenya, when the WFSA was setting up a pediatric anesthesia fellowship in Nairobi. I think, firstly, it's important to state that an anesthesiologist is a medical expert. When we think about medical experts, it's useful to look at the CanMEDS roles framework, which has been developed by the Royal College of Physicians and Surgeons of Canada. And this framework has provided a very useful model for people developing education programs and training systems for a variety of medical specialties. To be a medical expert, it is necessary to develop competencies in 6 main areas. These areas are professional, communicator, collaborator, manager, health advocate, and scholar. And I think that if we all consider our own jobs, we have competencies in all of these areas. I was very kindly given this t-shirt when I visited Nigeria and participated in the All African Anaesthesiology Congress in Abuja in 2017. As you can see on the t-shirt, there is a definition of an anesthesiologist, which states that an anesthesiologist is a doctor smart enough to take your breath away, skilled enough to bring it back. But I think it's really important to note that anesthesiologists do a lot more than just pass gas. The WFSA says that anesthesiologists are specialist physicians dedicated to the total care of the patient before, during, and after surgery. The WFSA goes on to say that anaesthesiologists are leaders in teamwork and patient safety and are experts in anaesthesia and perioperative care, resuscitation, intensive care medicine, and pain management. Now, what I really like about this definition is that it emphasizes that we are leaders in teamwork and patient safety. It also very clearly states subspecialty areas of practice: perioperative care, resuscitation, intensive care medicine, and pain management. What are the qualities required to be an anaesthesiologist? This list comes from an article entitled "A Career in Anaesthesia," published by the British Medical Journal, which is written for medical students and junior doctors considering various careers and medical specialties. The article lists 5 qualities: the ability to think quickly and methodically under pressure, a good understanding of physiology, pharmacology, and physics, manual dexterity, leadership skills and the ability to be a team player, and finally, attention to detail and self-motivation. I think this is a good list, and I think you would all agree that we need these qualities to do our job. But there are 3 key qualities that I would like to highlight, because I have seen these qualities time and time again around the world, and I think they are very important parts of what it means to be an anaesthesiologist. Firstly, the ability to lead and/or work in a team. We have a lot of skills when it comes to being a team player, and these are skills that are not necessarily always practiced by other medical specialists. We are also very good planners. This is one of the reasons why many anaesthesiologists end up getting involved in hospital management and administration. We're also very good planners when it comes to developing clinical plans for our patients. And finally, we have excellent attention to patient safety, and anaesthesiologists globally have been involved in the development of many patient safety initiatives and quality assurance programs. We think and breathe patient safety. My city, Christchurch, has had a difficult decade. In 2010 and 2011, we suffered a series of earthquakes that caused widespread destruction, significant loss of life, and a large number of seriously injured patients. In March of last year, we had to deal with a terrorist attack where 51 people were killed and a large number of seriously injured patients were brought to hospital. In these disasters, anaesthesiologists, in my opinion, were the glue that held the hospital response together. We played a key role in resuscitation and transport. We saved lives in the operating theatre. We helped to look after patients in the intensive care unit. And we helped to deal with some of the longer term problems, for example, chronic pain. We also played a crucial role in disaster planning and training before the events happened, and we helped to manage and organise the acute response. I think that you can think of anaesthesiologists as being the Swiss Army knives of medical specialists. We have multiple functions. We're often called on when there is a difficult situation, but we're always very humble, just like the humble Swiss Army knife. Unfortunately, many members of the public, governments, and other healthcare workers don't always understand the multiple roles that we play in the healthcare system. The COVID-19 pandemic has helped to raise our profile in many ways because of the prominent role that we have played in the response to the virus. We must continue to tell governments, the public, and other specialists about our roles in healthcare delivery. This picture is taken from the front page of Time magazine, and it shows an anaesthesiologist in northern Italy. And the photo was taken during the first wave of the pandemic. This man is described as one of the heroes of the front lines. And this type of publicity is very important for our specialty because it helps to raise awareness of some of the work that we are doing. The WFSA has been working very hard on your behalf to advocate for our specialty. 2015 was a very important year for surgical care and anaesthesia because the World Health Assembly passed Resolution 68.15, which called on member states to strengthen emergency and essential surgical care and anaesthesia as a component of universal health care. This was very important because it put surgical care and anaesthesia on the global health agenda for the first time. And we have been able to argue the importance of anaesthesia to healthcare delivery because of this resolution. Some of the key messages two of the key messages that we have been stating and restating is that you can't have universal health care without surgical care. You can't have surgical care without anaesthesia. And while these statements are self-evident to us, they need to be repeated for governments and for the WHO. This is a photo of me at the top presenting a short WFSA statement on behalf of anaesthesiologists worldwide at the World Health Assembly in Geneva last year. Last week, the WHO held a virtual World Health Assembly, and my colleague Carolina Haylock-Law presented a short statement on behalf of the WFSA. In her statement, Carolina reinforced the prominent role that anaesthesiologists have had during the COVID-19 pandemic, and she also called on member states to ensure that anaesthesia capacity is increased so that we can continue to provide excellent care for surgical patients. In summary, the anaesthesiologist in contemporary times. We are multi-skilled medical experts as well as anaesthesiologists. We have multiple roles, clinical and non-clinical, inside the operating theatre and outside the operating theatre. We have amazing skills, especially skills related to leadership, teamwork, and planning. Our roles and skills are not always understood by others, and we need to keep on telling people about the great work that we are doing. By doing this, we can argue for greater resources, and we must always remember to keep focused on the end game, which is to provide better care for our patients. I invite you to look at the WFSA website, www.wfsahq.org. There's a lot of information about what the WFSA is doing on this website. There is also some very good information about professional well-being, and this is particularly important during the COVID-19 pandemic. Let us hope that we are going to see an improvement in the global situation during the next 6 to 12 months. I hope it will be possible to meet face-to-face at the World Congress of Anaesthesiologists in Prague in September next year. Thank you again for inviting me to speak at your meeting. I hope you have a wonderful 3 days, and I wish you all the best. Thank you very much, and good day.